Hello viewers, today we are going to see various stages of gastric cancer. To understand this video, we need to have some background information of the normal layers of the stomach in microscopic detail. As you can see here, the layers of normal stomach from inside or luminal side to outside or its surface are the mucosa, submucosa and the muscularis propria respectively. The stages of gastric cancer are divided into two broad categories according to the depth of infiltration of the tumor mass into layers of the stomach wall. The early gastric cancer, as the name implies, involves superficial layers, while advanced cancer involves even deeper layers. The early gastric cancer, which is defined as adenocarcinoma, in which the cancer is limited to the mucosa and submucosa of the stomach regardless of lymph node status. In case of advanced gastric cancer, the tumor infiltrates beyond submucosa. Now you will see various types of early gastric cancer. This is the protruding type of early gastric cancer, in which the tumor mass is extending into the gastric lumen more than 2.5 mm in height. Now, you are seeing the superficial elevated type of early gastric cancer, in which tumor's mass doesn't infiltrate into deep submucosa and the tumor mass appears elevated above the adjacent normal mucosa but has a height no more than 2.5 mm. Now you are seeing superficial type of early gastric cancer, which is flat, that is the luminal surface of the tumor mass is at the level of mucosa and the deep extent of tumor mass is not extending into submucosa. Next, you are seeing the depressed type of early gastric cancer, in which tumor mass is eroded but not deeply into the submucosa. The last type of gastric cancer you are seeing is the excavated type, in which there are areas of necrosis extending to the muscularis propria without invasion of this layer by actual malignant cancer cells. The tumor mass in itself is confined to submucosal layer. Now you will be seeing the advanced stage of gastric carcinoma, in which there is involvement of muscularis mucosa and or serosa with or without involvement of lymph nodes. The tumor infiltrates beyond submucosa and is having much poorer prognosis than early gastric cancer. The first pattern of the advanced gastric cancer you are seeing is the exophytic type, in which tumor's mass extends into gastric lumen and also invades into the muscularis propria. The next type of advanced gastric cancer you are seeing is the Lynnitis Plastica, in which the cancer cells diffusely infiltrate the muscularis propria without any obvious protruding mass into gastric lumen and spreads to the muscles of the stomach wall. The tumor you can see involves the muscularis layer horizontally, sparing the superficial submucosa or mucus layer. This makes the stomach wall thicker and more rigid. This means that the stomach can't hold as much and doesn't stretch or move as it should when you are digesting food. This stiff-walled stomach is sometimes called a leather bottle stomach. Lastly, you are seeing an excavated type of advanced gastric carcinoma, in which the tumor has an appearance of prominent depression mimicking a gastric peptic ulcer. It is usually present in the body of the lesser curvature of the stomach.